get started. We are recording. All right. Well, welcome everyone. Good morning, good afternoon, good evening, wherever you may be in the world. I am Rushabh Shah, a manager on the prevention team here at NASD, National Alliance for State and Territorial AIDS Directors. My pronouns are he, they, and I am so thrilled and so excited to welcome you to our webinar today, Lessons Learned and Success Stories, Stigma Reduction Efforts Across Southern Communities. We're hoping to keep this webinar to an hour and 15 minutes today. So we hope you can stay here for the entire duration of the webinar. There will be some time at the end of the webinar where you will be able to submit questions and we will be able to answer them, as well as our fabulous speakers who will be joining us today. And so please keep those questions in mind, and please feel free to let us know if there's any questions that you would like to chime in with, and we can also help answer them via the chat feature or through raising your hand. So thank you so much for being here. So for today's webinar, we are really going to dive into some stigma reduction efforts that are going on across the South. As health departments and community-based organizations begin to combat HIV stigma across policy and programs, they can really begin to leverage successful strategies from across the South to identify areas for new engagement and more comprehensive planning with key populations. This webinar that we're going to cover will highlight high impact lessons learned from the CBO or community-based organization perspective, while offering all of you attendees the space to explore how to meet existing challenges at home with peer-to-peer collaboration. While stigma presents differently in every community, this webinar will spotlight high-level patterns, opportunities for success, and gaps that may exist institutionally. We're hoping that we can review lessons learned from the Synergizing Stigma Reduction and Policy to Enhance HIV Prevention Programs workshop that NASD hosted in January and highlight the impact of new stigma reduction goals that were produced. We hope that we can brainstorm immediate opportunities for collaboration, key areas of high need, and long-term solutions for existing institutional practices. And finally, we hope to identify community-based organization policies and programs that are successfully combating HIV stigma and explore the life cycle of these tactics from conception to implementation. We're really excited to be doing this with some peers in the field and some community-based organization speakers that we have lined up for you today. But before we dive into that, I wanted to just quickly introduce you all to our organization. I know some of you may not know a lot about NASD, or this may be your first NASD webinar, but we are a nonpartisan nonprofit association founded in 1992 that represents public health officials who administer HIV and hepatitis programs in the US. We are based in Washington, DC, right next to the Capitol building, and we represent all 50 US states, the District of Columbia, Puerto Rico, the US Virgin Islands, 7 local jurisdictions receiving direct funding from the Centers for Disease Control and Prevention, the CDC, and the US Pacific Island jurisdictions. And we do all of this work by interpreting and influencing policies, conducting trainings, offering technical assistance, and providing advocacy mobilization for health departments across the nation. We have a very robust mission, which is to end the intersecting epidemics of HIV, viral hepatitis, and related conditions by strengthening domestic and global governmental public health agencies through advocacy, capacity building, and social justice. And above all, our vision at NASD is a world free of HIV and viral hepatitis. Currently, under our funding that we received through the CDC, it is called PS 19-1904. We are a capacity building assistance provider, or a CBO provider, for high impact HIV prevention programs and their integration work. So we are funded to do Track C under this cooperative agreement, which is integrated HIV activities and structural interventions. So this includes a slurry of different activities from partner services, data to care services, social marketing and social media strategies, syringe service programs, drug user health. social determinants of health, condom distribution, and many more. And where we are funded to do this work is only in the US South, as designated by the CDC. So while many folks may not necessarily consider Delaware or DC to be the South, we are funded to do work all the way from Texas to West Virginia to Delaware to DC, and it is highlighted in blue over here on this map on the screen. So if you are in any of these jurisdictions, this is where we do most of our technical assistance and capacity building. And we hope to offer as many of these services that may be relevant to your needs at some point in the future as well.
Awesome. Thank you so much for your shop. So now that we have gone over a little bit of what NASD does, I'll introduce myself quickly. My name is Ilana Ross. I use she, her pronouns, and I want to introduce you to our two lovely speakers who will be presenting during this webinar. So first, we're going to be having Greg speak, and then we're going to be having Lakeisha speak. I'll introduce them both momentarily, and then we're going to have questions at the end. So if you do have questions, feel free to either put them in the chat or the question and answer feature on Zoom is enabled. You should be able to go to the bottom of your screen, and there should be it sort of looks like a double speech bubble icon, and you can click on it. All the questions are anonymous, and I believe I've enabled the Zoom feature where you can upvote and comment on questions as well, sort of make it a little more interactive and fun. But yeah, so I want to introduce you to our two lovely speakers. Like I said, Greg will be going first. So Greg Casillas, he is the Assistant Director of Thrive Youth Center, and Thrive's mission is to provide a safe and supportive center for homeless LGBTQ youth who are 18 to 24 years old, so that they can become productive, skilled, educated, and successful adults with the abilities, opportunities, and possibilities to achieve their dreams. Greg is an active member of the San Antonio community, and most recently, he was the co-chair of the Ryan White Planning Council and the co-chair of the End Stigma and HIV Alliance of San Antonio, which is a collaboration of all the HIV and AIDS organizations in San Antonio that are committed to destigmatizing and ending the HIV epidemic. He also serves on several other community-based initiatives and takes part in university-based student projects. Greg often reminds people that silence equals permission and that it takes just one voice, let it be yours. And our other panelist, our other speaker, Lakeisha Harris, she is the writer and host of Old Pro News, a podcast dedicated to education on the current issues, legislation and policy and activism of sex workers globally. As the former director of reproductive health and justice at Women with a Vision in New Orleans, Louisiana, Lakeisha worked to spearhead the first comprehensive statewide bills in the nation to decriminalize sex work. So during the 2021 legislative session, 119 sex workers and allies provided 3 hours of testimony in the Louisiana House, which was a first not only in the Deep South, but for any state house. Her 20 plus years as a reproductive justice leader have produced 2 amicus briefs that were presented to the Supreme Court on behalf of abortion access, and one is currently being considered in the Dobbs versus Jackson Women's Health Organization case. Before moving to the Deep South, Lakeisha was an organizer, health educator, and insemination coordinator in the Midwest, where she was providing comprehensive care to sex workers, women, transgender people, and gender nonconforming individuals at one of the last remaining feminist health centers in the country, the Chicago Women's Health Center. So please join me in welcoming Greg and Lakeisha. And now I will stop sharing my screen and hand it over to Greg.
Good afternoon, everyone. I'm going to see if I am able to share my screen now. Great. All right, we've got it up. So again, my name is Greg Casillas. I'm the Assistant Director of Thrive Youth Center here in San Antonio, Texas, and the former co-chair of End Stigma and the HIV Alliance. And so being part of that, I am also an individual living with HIV and have been for the last 21 years. My oldest brother was diagnosed in 1983. So when we're talking about stigma and the ways that is impacting our lives, both as providers, as receptionists, as anyone living in the community where people are living with HIV, As a person living with HIV, and we might say I come to the table with a lot of jackets and a lot of stigma already, and trying to find those places where I fit in, not only as a patient, but as a community member. So ESHA, in Stigma and the HIV Alliance, was created out of a national cluster that was identified in 2016. And in 2017, San Antonio became a fast track city. And from the fast track cities, the In Stigma and the HIV Alliance was created. So as Ilana had mentioned, we are, part of the service providers, the CBOs, community-based organizations, anyone that might be affected with HIV is who ESHA is, the membership that comprises the In Stigma and the HIV Alliance. So as I move down, when we're talking about stigma and what that might come across as, it's the negative attitudes and beliefs about people with HIV. It is the prejudice that comes with labeling an individual as part of a group that is believed to be socially unacceptable. So when we as an organization did a little dive into how we could impact stigma within San Antonio and Bexar County, we took a multifaceted approach. We did anonymous journals in provider institutions where individuals that are in the waiting room could anonymously write in the journals and return it to reception. We did a live HIV storytelling project. So we had individuals literally on stage that were comfortable sharing their experiences of, when individuals were diagnosed, to their care and prevention and these sorts of things that begin to impact our lives. We also did a survey out to providers, Ryan White providers, non-Ryan White providers, to find out where they fall with regard to stigma. And, we were able to identify some of the knowledge gaps, even amongst the healthcare workers, lack of knowledge with regard to PrEP and modern antiretrovirals. We talked about the discomfort and lack of knowledge about avoiding stigmatizing language, the fears of infections, intolerant workplace cultures. So we were able to have these focus groups with these individuals that were willing to participate and share their experiences. And we came down with the structure of these anti-stigma guidelines and broke it out into 3 parts. One at the individual level, understanding that in healthcare, every person and every interaction has the power to reinforce or refute HIV stigma. The second is the work culture level. From the operating room into the boardroom, the healthcare leaders must set the example and cement an anti-stigma culture within the workplace. The last area was the organizational level. Understanding that long-term shifts in norms require procedural and systemic changes. So when we have the opportunity, to impact those at each of those levels, and we're able to break it down, we have found that the opportunity to have an open dialogue without shaming, holding each other accountable, all of those sorts of things begin to impact where we are in our preventative efforts of stigmatizing. So when we're talking about what we do with regard to this area, we made the pledge, with the effort to end HIV by 2030. Some of the groups that we involved in the focus groups were the San Antonio's People's Caucus, which is part of the Ryan White program. We involved San Antonio Metro Health, lots of community-based organizations that allowed us to enter into their community. And that's one of the important things that we're finding with regard to having those conversations is it's very difficult to make inroads unless we're introduced. So when we have that opportunity and we're invited to a community-based organization, we have the opportunity to be a trusted organization to come in and have those conversations. So when we're talking about the individual level, and what we found success in is changing and encouraging testing and reducing the trauma of the diagnosis. We have changed the language as opposed to celebrating the opportunity of a negative result and not indicating that someone is clean, that indicates that someone is dirty. So when we have those individual level conversations about what that language looks like, we want to counteract the stigmatizing messages from patients' families, the cultures and communities. When we're talking about the U equals you, one of the largest things that we're finding right now is that stigmatizing language that U equals you. Well, there are some individuals that may never be able to have an undetectable viral load. So we have to be mindful of where that stigma then lies within our own community to be able to not have that sort of language and attitude towards the U equals you. We also, with regard to the individual level, showing our patients that we see them not only as a diagnosis. We want to treat the whole person, mind, body, and spirit. So changing that to a people's first language. And we also have to understand that happens when we have dual populations or communities that may already be suffering from stigmatizing language or beliefs, the LGBTQIA population and those individuals that may be living with HIV. So when we're talking about a person living with HIV, a person with a substance use disorder, again, on the individual level, changing those opportunities to have that conversation in a manner that is people's first. We also want to make people feel comfortable in the exam room, following normal standard safety protocols. But we found in San Antonio that there were still providers that were double gloving, that would wipe down the patient seats and avoid contact. And there is the opportunity to just change the way and change those behaviors and hold the individuals accountable as peers without a shaming opportunity or shaming conversation. It's more of an education and knowledge that we have found works well within the community. The other part of the individual level is making sure that we encourage people to stay or re-engage in care. We all know that it doesn't work when we lecture individuals about why they may have missed an appointment, and changing that language to, if there is a missed appointment, to call and say, hey, we missed you yesterday. Is everything okay? Rather than shaming that person. Why did you miss? What was going on? What happened? You're supposed to call. Those sorts of things are all individual level changes that we can make that can definitely impact stigma within the healthcare environment. The other place that we identified was the work culture level, that understanding that everyone can make a difference, creating a shame-free zone. A stigma-free work culture begins at the top. A good team leader or employer leads by example. So treating patients with respect, using people first, non-stigmatizing language can go a long way in sort of mentoring that for the individuals that are in the workplace as well. Understanding that names and pronouns matter. It's okay to say those and ask those questions at the initial interaction with reception so that we do get it right. If we don't get it right at the initial conversation, that may prove to the person that they're not welcome, that they're not part of, they're not understood, and may cause them to disengage. So when we have that opportunity to really enforce pronouns and names, having that opportunity to do it. We also want to make sure that we hold each other accountable. Having a colleague conversation outside of the workplace, taking a break or in the break room, and definitely not in front of others or in front of patients. Being able to have that conversation of, hey, what I found is this may work better, may work differently, and not putting it as a you and I or a bad versus good, but a different opportunity to approach a situation. The last part of the workplace culture is empowering our patients. When it comes to retaining individuals living with HIV, the relationship and respect matters. So by making shared decisions, collaborative decisions, and it really, we may have all been in that exam room where the doctor or provider may only look at us once or twice, and the rest of the time they're documenting. And we need to make sure that we're enforcing a conversation as opposed to a transaction. And when we have that opportunity, it gives agency to the patient so that they feel as if they are making decisions for themselves, and they're entitled to make those decisions for themselves. So we have to make sure that when we do have those opportunities, we're reinforcing them, and we're spending a little more time on, the work culture level to ensure that we're all safe, and being able to understand what that might seem like. So the last area is the structural level, the organizational level, and where that is. Formalizing anti-stigma training. How do we incorporate these sorts of conversations in our staff meetings, in our quarterly efforts? How do we prioritize peer support and warm handoffs? Making sure that if I have built a relationship with an individual, I'm not going to hand them off to another organization that may not have those same values. So understanding and sort of vetting those individuals and making sure that we have the pronouns and the names correct on all of the information. And that's a conversation with the patients and clients as well. Being able to say there will be some questions that may be redundant. They have to do that on their agency side in order that they're compliant with any services that they may be able to provide for you. So setting up and not letting the client have any blindsided conversations about I've already said something, or already had this conversation, making sure that on a structural level, we have those warm handoffs. The other part that we are really focusing on here in San Antonio is creating a process that encourages single capture histories. We forget that having that conversation can be re-traumatizing with regard to how a person contracted HIV. And we have to understand that every time we take that back to zero. So if we have the opportunity for the single capture and the opportunity to not have something that happened for me 21 years ago, why is that relevant now in my care? And so I think when we work towards those single capture opportunities, we do a great service to the clients and to the patients that are sitting in front of us. Lastly, we have to rethink the rules. We have to re-examine our own procedures and regulations that might make people less likely to engage. How do we create it do I see myself in this provider office, in the reception area, in the people that are working with me and for me, to be able to have this opportunity to lengthen my lifespan. So when we have those opportunities to rethink the rules, are we taking care of the staff that are working? Are we at the same energy level as our first patient that we engage with during the day, as opposed to the last patient that we're engaging with? Are we afforded by our organization the opportunity to take those breaks, to take that little bit of mental health opportunity to recenter and compartmentalize? And those are the things that we as providers and we as individuals working with this population and in the world of the HIV, we carry a lot of coats at the end of the day. So if we aren't being taken care of and aren't having the opportunity to be able to take that little break and reconnect so that we're present and engaged for our next patient and client, those are organizational challenges. And we deserve and we're entitled to voice those opportunities of how things might work differently. So rethinking the rules of where we stand and how we can impact those opportunities for our patients and clients. So these are those three levels. We have the individual level, the workplace culture level, and the structural level. And with all of this, Ilana and Rushab have the anti-stigma guidelines that are available and I believe will be distributed to everyone. We are more than happy to share all of this and even the data and research that went into formulating the anti-stigma guidelines. We are happy to share those with anyone that might be interested. So that is my bit of information. Again, my name is Gregory Casillas. This is my email, and Alfred Chavera, he is the Ending the HIV Epidemic Program Coordinator here in San Antonio. This is his email. Please, with any questions or any further information, don't hesitate to reach out, and we will be happy to answer, provide support, and share anything that we may have. So thank you for the opportunity to share our work here in San Antonio with you all today.
Thank you.
Oh, go ahead.
No, yeah, thank you so much, Greg. And thank you everyone for your questions. Keep them coming. We'll be kind of answering all the questions at the end. So we have as much time for the speakers to talk about some of their best practices and lessons learned. So moving on, I am so grateful and excited to welcome Lakeisha into the space. She has come from what was a very difficult situation in Louisiana last night with the weather and some news with a hurricane and a tornado. So we're really glad you're safe. We're really glad you're okay. And we're so beyond honored that you're able to join us today. So without further ado, I'll turn it over to Lakeisha.
Hey, everybody. And thank you for giving me grace. I'm very excited to be here. I am Lakeisha Harris. I am the host of Old Pro News. Old Pro News is informational podcast that gives up-to-date and relevant information about the lives, lived experiences, events, and the push for decriminalization around the nation, but also globally. And I am also the former director of reproductive health and justice at Women with a Vision here in New Orleans. I am very excited to bring my presentation, and it's about the push for Deepcram, but also like the push for sex work Deepcram is the push for like HIV, STI destigmatization. It is the destigmatization of sex work in general and not commingling sex work, the labor side of things and consensual side of things with human trafficking, which is two different things. And we've had to spell that out a lot in community. Also, the stigma behind sex work, right, is that sex workers spread STIs, HIV, that they're not practicing safer sex. So kind of giving the community information and background about like who sex workers are, and that most sex workers are really cautious about their health and going to the doctor. And sometimes when sex workers are in medical care, right, they are stigmatized by medical professionals. And also, so we need to navigate those spaces and stigmatized by community and criminalized, hyper-policed, hyper-surveilled. So I'm going to talk to you today quickly about like the decriminalization of sex work campaign that I count as a major success, because it was a campaign primarily to educate and destigmatize in community, to make sure that people understand who sex workers are, what the labor is, why sex workers are at risk for community violence and state violence. So I'll share my screen. Okay, share. Okay, so let's go to the Deepcram campaign itself. In order for us to get to the Deepcram campaign, right, things had to happen before we got here. So I want to say to you all that a good campaign, especially one to get rid of stigma and shame, has to be something at least in a 3-year worth of planning phase, right? You want to get community involved. You want to get public officials involved. You have to, and education is a slow process. So I want to go back to where we started, right? The root of all of the work at Women with a Vision, but the root of my work also, and I've been doing this a long time, is the old saying from disability rights: nothing about us without us, right? A lot of disability advocates have presented that information. And what that means is you can't do this work without community. Without the people, you can't put forth policy for folks who are, and you haven't engaged those folks that are going to be directly impacted by those policies. They should make up whatever material you're going to have. They should make up, and not just, hey, come to this meeting, we're going to give you a $5 gift card for your input. No, actually, you have to engage them in conversation and build long-term relationships. And if there is policy that is associated with their living and existing, those friendships and relationships should be like long lasting, and they should be in those rooms with public officials that are making the policy, right? So we were thinking about Deepcram, or the de-escalation of police violence in the lives of sex workers and people who engage in sex work years ago. I mean, Women with a Vision, a shout out to Women with a Vision, the Revolutionary Act of their No Justice campaign in 2011, where it got sex workers off the sex offender rolls in the land, which means that they had so much difficulty getting jobs, housing, like sex offender was written on their license, all of that. Women with a Vision and Dion Haywood did that work. So, but that still was like the primary foundational work, and still sex workers in the state are being criminalized, hyper surveilled. When they go to the doctors, they're judged right away by their labor and assume that they are not using or having protective sex, that they're spreading infections and diseases. So we had to have those conversations. And I started out in 2017 with Community Care Night. And within Community Care Night, right, sex workers showed up to be the providers. Sex workers are healers, and they wanted to be the Reiki practitioners, massage therapists, the people who provided acupuncture. That's who were the healers at my Community Care Night. And I think I'm pulling up. And then from that and developing that relationship, we started the Sex Worker Second Line on the International Day to End Violence Against Sex Workers. And again, developing relationships with those people who are directly impacted is integral. So then that happened back in 2017. Again, the campaign was last year, 2021. So several years in the making. And in between that, we stood with area sex workers when there were different laws. In 2018, they were targeted, sex workers in the clubs on Bourbon Street were targeted, and those clubs were raided and shut down. When they needed somebody to go before a city council and stand with them and make sure that their job spaces were secure, we were there, right? They came to Community Care Night, provided care for the community, and then in response, we were there, developing those primary relationships. Then you get to have a conversation with the sex workers that help develop the toolkit. Hey, what are you seeing in the street? How is law enforcement treating you? How are medical doctors treating you? right? What is the culture of your providers in healthcare? Like, how do they see you when you arrive with your children? Are they shaming you in front of your children about the work that you do? Are they receptive? Right? So all of those conversations were being had in the background while seeing who, as a legislator, would be brave enough to say, I stand with sex workers. This is labor. It is consensual when they are adults, and we should not be incarcerating them and putting them at greater health risk and jeopardy from being incarcerated and away from their families and targeted by child protective services, all for trying to survive and make a living. As a former sex worker, right, I felt like I had a duty not just to speak up on their behalf, but what I experienced while raising my children. So then is where I insert my narrative and be unafraid as I was asking criminalized folks currently to be in front of policymakers. So there was for me, it was a no-brainer. You had to speak up also and come from an authentic place. I want to show you the beautiful work that came out of that collaboration really fast. Where's the toolkit? There we go. Sorry about that. So if you have not visited the website, you can go to deepcram.org. All of the material and background and campaign and everything, outreach, we strategically planned together. Sex workers were at the table. They provided the language. As a former sex worker, I put my experiences in there. And we all reached out and contacted organizations. So everything that you see here is like organizations that have, skin in the game and of like decriminalizing sex work, decriminalizing HIV and STI, have spoken out on what reproductive health and what reproductive justice is, and in some form or fashion support the work and support decriminalization. And we all reached out to these different organizations, asked them their stands, would they stand with us? And as you can see, like just on the first outset, these are all organizations situated in the South with a national harm reduction, encompassing a national harm reduction ideology, right? And then we get into like all of like why it's bad to destigmatize or to stigmatize people in the sex trade, why sex work should be made legal, what are the ramifications of like seeing sex workers as primarily like a single narrative of trafficking, because right, you're not just harming sex workers, right? You're not just criminalizing sex workers, you're criminalizing folks who are being trafficked. So like people who are trafficked are still arrested for prostitution, right? They are taken to jail. They're not just automatically taken home. So like giving people a blanketed narrative harms everybody, even those people who are trafficked, right? And it doesn't help those people who are engaging in consensual sex work for survival, for money, to take care of themselves and their families. So it's a hard job, like to talk about the hard topics. I want to say that it wasn't, and this is a kind of a drawing of our sex worker, Black and brown sex worker second line. It talks about and it speaks to like the beginning or the roots of this single like campaign. It's a hard job to talk about difficult topics, but that doesn't mean that we shouldn't talk about them. It means that we have to develop relationships in order to talk about them and be in right relationship with community and legislators and be unafraid to tell the truth, right? It is the primary reason why HIV is criminalized, is because people are, not educated on the subject of what transmission is, what it looks like, who is impacted, like to tell these hard truths and get into the woods of and the details in HIV, in sex work, in trafficking. Like, all of us have to be sitting at these tables for these integral conversations to break down stereotypes. We also did really good and a thorough job on investigating and presenting the history of sex work. Like, we go back and talk about, like, why sex work is sex work and what happened on this ground. Like, we talked about the racialized history, and we got Melinda Chartivier of she's a historian and professor, and she really worked with our history collective that is made of current and former sex workers, and went back into the history and developed the narrative of the history. So you have the history and Marsha P. Johnson in there, which I just love. And the Sex Workers Against Criminalization, or SWAC, was made up of current sex workers and former sex workers, and it is in existence now, and they are still holding up the banner of this Deepcram legislation. So though we pulled the Deepcram HB 366, the Deepcram bill, because we knew we didn't have enough votes, what worked really well was us getting involved in community, like the New Orleans DSA did canvassing for us, and they canvassed the whole state and had really good, rich conversations with community members and educated on how we taught them to educate. So I think that is all. I hope that you all, and I also want to talk about what came out of our second line was on the International Day to End Violence in December 17th of 2018, we also had Mayor Cantrell make a statement which helped us in the long run, that said that this is a public health, sex work is a public health issue, and one we need to discuss. Or violence against sex workers is a public health issue, and one that we have to openly discuss as a community. Stigma and shame put lives at risk, which is huge. Like, at that point, no mayor came out to talk about the harms as a public health issue for sex workers, and Mayor Cantrell did it on the Day to End Violence. So that was huge in pushing the campaign that we wanted to see. So we started educating community members, public officials, and sex workers did that. So I think that's all I want to say. If you have any questions, I can go on and on about this. If you have any questions, let me know. And I do apologize. I had some sketchy internet services.
Thank you.
Thank you, Lakeisha. I want to make sure I can. Okay, awesome. So we really appreciate you being here and sharing that with us. We know we don't always get to see the sex work destigmatization side, and we want to make sure that we're having people learn from various people in the field. And yeah, so we want to open it up to questions. If you have a question to ask, you can put it in the question and answer section, or you can put it in the chat. And I believe that we do have one first question. The question is from Darlene. And Darlene said, did I understand correctly? Does Greg feel U equals U is stigmatizing in a way? Thank you.
Darlene, thanks for the question. And I believe it can be at times, even within the community of individuals that are living with HIV, there can be that opportunity where individuals may have the notion that someone is not adherent to their medications because they have not achieved an undetectable viral load, that they could potentially not be adhering to where their regime might be. With regard to sex work, and Lakeisha, help me out and join in here. If there are individuals that know other people's status, they may use that against them, you know, and use it as and for it to be weaponized in the manner of, oh, that individual doesn't have an undetectable status, so I don't know if that person is safe. So there's the opportunity for it to be utilized in a manner that is not supportive of the individual or the way that it can be in conversation.
Yeah, that can often like be used for someone working in sex work, like knowing people's status or knowing people's background or any information that maybe they don't want the public to get out, right? Even like knowing people's proper name, like most sex workers don't go by like their government name, right? So even like knowing somebody's full name or proper name, because it's so, sex work is so stigmatized in community, if somebody gets a hold of that information and like outs you, that's a big thing. You can lose community resources, community respect, what have you, when this is clearly tied to labor. So yeah, all of that can be used.
Thank you both. I wanna, there's a follow-up question in the chat from Melvoretta. Melvoretta is asking, what's an alternate conversation for when you equals you is not achievable? And I want to emphasize that Greg isn't saying that U equals U is bad. I think he's just emphasizing that it's not always possible for people to be undetectable. We want to be aware of that.
And again, thank you very much. And U equals U is not stigmatizing on its own. There is an opportunity for individuals to use it in a stigmatizing way. I think that is absolutely something that we should all strive for. But there are opportunities for it not to be achievable. And having that conversation when, you know, the alternative conversation is to be honest, you know, and say, as a provider, we are going to do our best in partnership to work for you to be here. And there are opportunities where it hasn't been achievable, but that does not mean that you are any less than. That doesn't mean that you are not adherent. That doesn't mean that you aren't participating in the care and prevention that you are striving for. But it's having that honest conversation. And that's where the agency for me as an individual living with HIV is I have to be aware of those. And those are questions that I want to ask. So as we provide those individuals with tools and opportunities, that's where it doesn't need to be a transaction. It can be a conversation. And how do we have the buy-in of the patient and as the provider?
There's a bit of a follow-up to that in the chat. Greg, did you see the second part of Melvoretta's question? Oh, just kidding. You answered the question. Perfect. Right on time. It looks like we have another question. I'm gonna click answer live and see if you all can see this. But I don't think you can, unfortunately. We are new to Zoom webinar. So I thought maybe if I clicked answer live, that question would show up on the screen, but unfortunately it's not. Lakeisha, this question is from Kirsten. She's wondering if you had any involvement or support in the campaign from your local or state health department. She says, I know health departments are limited in how they can get involved in policy and advocacy, but do you have any suggestions for how our governmental public health partners can support decriminalization efforts?
So I'm going to say, no, we did not have help from our health department. And it's because, right, there's more money going into trafficking resources, and rightfully so, sex workers don't want people to be trafficked, but it's very hard to have this nuance, which is why we started the campaign, to have the nuanced conversation that there are actually people that participate in sex work, and there are people who are being trafficked. Like, we have to veer away from the carceral feminist models that says no one can participate in sex work, right, willingly, when it's not true, because it criminalizes everybody and it puts everybody in harm's way. So to make a long story short, no, we did not have the Louisiana Department of Public Health's help, because mostly they are in alignment with very conservative ideologies of what like bodily autonomy looks like, and it's of detriment to many in our community, quite frankly.
So I have a follow-up question kind of along those lines. So, because of these conservative values and some of these limiting institutions that aren't aligned with us, what do you think could be some effective low-hanging fruits and policies that we can do to better partner with community members? I think it's so vital to make sure that we have some partnership, some movement. And so what are those smaller little nuggets that we can all access?
Right. I think that some of the fault, like, we can't get to decriminalization. Like, we can always start out with shining a light on the bigger goal, right? That is our vision, to get towards decriminalization of sex work. But now we can kind of pull back and be like, all right, now what is it that we want? We want sex workers to be able to report instances of violence without like being afraid of going to jail. We want sex workers to be able to present their income for housing and be like, okay, well, like a carpenter who is an independent contractor and can present their income for, and they don't have to like be like, where did you get this money and where did you get that money, right? Sex workers should have housing. They have families, not just children, but extended family and kinships that are formed and people housed together. We're in a pandemic and it's been really tough for folks, right? So we want to be able to have access to housing and medical service, right? Having discussions with medical professionals that is not, when a sex worker come in, they're not shamed about like how many partners they may have had. Like, we have to change and rethink language. So some of those policies are just about us changing our perspective and is indeed the low-hanging fruit, right?
And Lakeisha, I think, for the demographic that I work with here at Thrive Youth Center, 18 to 24, and the LGBTQIA population, individuals at that age that are criminalized for prostitution then have a very difficult time obtaining housing if they are employed legitimately, in quotes, and having that opportunity, because then leasing agents, landlords are very skeptical of renting to individuals that have a prostitution charge on their record. And even a solicitation charge where stepping off of the curb to speak to someone that asks you if you want to ride at a bus stop with a youth that is experiencing homelessness, those are the things that we need to address as well. So
Right.
Bringing light to those conversations and making sure that we aren't shying away from the difficult conversations that you were speaking of is making sure that if an individual hasn't found their voice yet, we're entrusted to share their story and to shed light on the opportunity of what that might be like. And as you were saying, Rashad, with regard to how do we pick the low-hanging fruit, is we as individuals need to make sure that we aren't perpetuating that HIV is an LGBTQIA illness. What is the imaging? Are there individuals that are in a heterosexual relationship? Is that the image? Is it always two men? Is it always a trans individual that is being portrayed in the ad and the verbiage that is going along? With regard to PrEP, is it always two white guys that are in an advertisement for PrEP? That insinuates that it's not for everyone. So we as organizations have to make sure that we are looking at what messages we put out as well. Are we asking for numbers with regard to HIV incidents within individual demographics that aren't identifying as LGBTQIA? Where are those numbers? So we have to ask for those. We have to inquire for those from our state agencies, from our city agencies. So when we're talking about low-hanging fruit, it's a question. And, you know, when the tired get loud, we get louder, you know, and with respect to being interviewed, and when you're talking about surveyed, we're tired of being surveyed, because we're surveyed and no one ever comes back to us to tell us what the results are and gives us an action plan to move forward. So we're tired. A $10 gift card is not going to work for me. But if you want to have a community engagement and a town hall to say, we did all this research and we surveyed 1,500 people, now we want to come back and tell you what the findings are, and how do we communicatively and collaboratively start to make changes based on the research questions that we asked.
Thank you. Yeah, I literally have 80 additional follow-up questions, and I'm sure so many other folks in the chat do too. I want to give some of our participants time to ask some additional questions. But one last question I'll ask, and I'll shut my mouth after this, is, you know, how are you integrating the folks who are specifically impacted by the stigma that we're trying to reduce into these efforts? So like, we have different ways that we're trying to access these low-hanging fruits, but how do you make sure that those tactics include the folks who are impacted, and not just necessarily including them in a survey or including them in a focus group, but how are we making sure that any of these stigma reduction efforts involve their voices and involve their lived experience? And I'm curious to hear briefly from both of you how that works for you.
Well, you know, we have a whole toolkit done by sex workers. You know, we have 3 hours of testimony where they actually went to Baton Rouge, filled and packed the whole House Criminal Justice Committee. So that is in archive and it has been used. We make sure that we paid sex workers a living wage to do this work. It wasn't like, well, I need to survey you, right? And then you give us your feedback in a survey, right? It was like committed to the long-term developing of relationships and maintaining those relationships even today. You know, how can we see them not just as sex workers, but as workers with families and real and identities that have to navigate a pandemic, just like, you know, a construction worker, a nurse, or whomever have to. So making sure that you humanize the experience, the need, and center their voices in every aspect of the doing of things. So, so when folks look at, go to deepsouth.deepcram.org, know that they are looking at the work, the words, the experiences of those who were directly impacted.
And for us here in San Antonio, we have a storytelling project that is actually happening and it's underway. We're in our first year, and it's an NEA funded project where we're asking individuals first who are living with HIV to share their story. We're then going to community support healthcare workers and then families as well to share their stories about how they're affected by HIV or how they have been affected previously. Then these stories are going to be housed in the Nixon Library here at the UT Health Science Center, and that will become part of the curriculum for anyone going through med school, that HIV after 40 years is still present. And when we're talking about stigma and relationships and where that has come, it's no longer the transactions, they're conversations. And these are stories that will hopefully enable med students, not only with regard to HIV, but see things a little differently. And again, treating the whole person, mind, body, and spirit, not just their symptoms and ailments.
I love that. Thank you so much, Greg. And thank you so much, Lakeisha. These are really fantastic sentiments. And I know that our audience members are really learning a lot from both of you. I had someone private message me a question. They were wondering if you can share some unique examples of how stigma shows up in your communities and how that relates to stigma in the US South. And that was for both of you, but take a moment to think for sure.
So here in San Antonio, we actually did a city and county-wide collection of individuals with regard to healthcare. And it was an astounding 70% of the individuals that participated in our town halls and gatherings and convenings avoided going to healthcare providers because of experiences they have had previously. We have had individuals that reported being either verbally or physically assaulted in a provider space because of how they identified. So these are true stories from individuals with regarding care in San Antonio. And those were astounding to us. And being able to come up with these anti-stigma guidelines that are not just for Ryan White ASOs, these are for every provider that can be here in San Antonio. And that's why we're doing these sorts of convenings, is making sure that this information is shared so that each community can take these as a skeleton and be able to develop it appropriate for their community. But all of these stories, you know, one of the things is here that I'm looking at my notes is at some clinics and doctors' offices, the receptionist can be very rude. I always speak up, and there are lots of clients who cannot do this. The receptionist is usually the first person they come in touch with. And if they don't feel respected, they may just walk away and we will lose them. And that's from an individual that is living with HIV, and that is their perception of when they're in the waiting room, how those interactions look like.
So before I answer that, somebody sent me a question about whether or not I'm saying legal prostitution should be presented as a career choice for young people, the way other career choices are presented. And that's what I was reading when you were presenting your question. So I want to clarify that, right? I want to say that career choices are up to the people who want to make those career choices. It's bodily autonomy, right? And we shouldn't shame them for whatever career choice they make, right? Second of all, we are not asking for sex work to be legalized because, right, that puts the onus on the state of who can be a sex worker, who could get licensure. For sure, it will be those folks who have already been arrested will be more marginalized and criminalized because of that process and the state holding all of that power, right? So what we are asking is that the police don't incarcerate folks who have to use sex work as a tool of survival, to destigmatize it so that when they are entering into spaces of like healthcare, right? Or their children's school, that they are not seen as a prostitute, but as a worker, the same as anybody else. So that's the long answer to the question that was presented. Yeah, that's what I got.
Thank you so much, Lakeisha. We really appreciate that. And I think you do a really fantastic job framing these really difficult answers surrounding sex work, and knowing that it's not a topic that people are necessarily as used to talking about on a regular basis as you are. Do we have any other questions in the chat? I know that Varushab and I have a couple more questions, but we want to make sure that we're making space for all of the audience members to ask their questions. As you can see, there is nothing that is off limits. You are really welcome to ask our panelists anything. They have quite literally a wealth of knowledge for you.
So I'll let folks chime in the chat. I think folks can continue ruminating, but in the meantime, I'll go ahead and ask my question so we don't lose time. I'm curious to kind of now hear more about some of the barriers that you've been facing, and how these barriers are going to be, I don't want to say tackled entirely, because that assumes that we're going to move past them entirely, but how are we managing them, and how are we making sure that we don't lose any steam that we've gained with stigma reduction, but we learn to manage with what exists and how kind of structures are there in place right now. I know immediately I think of Louisiana and the state, and how it's not necessarily, the government is not necessarily a friend of ours in this work. And so how are we doing creative movement around these barriers?
So I'll go. One conversation at a time, like doing these, which is so helpful. I'm so glad that I was invited. But like having one conversation at a time. And I think that in the state of Louisiana, like we're battling so many stigmas, right? I mean, and hard in the South in particular, but nationwide, there are a lot of bills that are cropping up that are, taking away the humanity or picking away of the humanity of trans folks, like and specifically trans youth. And when I hear people say, that we're gonna not allow trans youth to get the medical services that they deserve, or or force the parents, the probably some of the only supportive parents there is, because let's be honest, trans youth get kicked out of their houses because their parents are not supporting them, which then trans youth will go into sex work to support themselves and be further criminalized, and not be and be shut out of housing and all kinds of stuff, right? So I guess what the 10% of folks that actually support their children and their health care and meeting their needs, you're going to criminalize those folks. So, we have to present real information, accurate information, and not sugarcoat it sometimes. Like right now is not the time to sugarcoat that information, and we have to be unapologetically asserting the needs of the people in our community, whatever those needs are. Especially in this moment, it is imperative that we destigmatize the labor of folks, and also the healthcare of folks. Like these are necessities that people need to live in a pandemic when so many people have died globally.
Thank you. Absolutely. I very much want to echo that. And I think, there are different ways that the barriers that we've seen have shown up across the nation. And I think it's so important that we hear what's going on from your side, Lakeisha. So I just want to express gratitude that we have this perspective, and that we can also integrate it with our own work as well. I want to give folks, I'm looking at the time and I'll be mindful of time. So I want to give both of our presenters the floor, seeing no other questions right now in the chat or in the Q&A feature. Our presenters the floor just to share any final thoughts and any final ruminations that you'd like to share with our attendees and make sure that you get all of your thoughts out. So I'll turn it over to both of you, and then we'll take it from there.
I think for me, it is, going back on your question, Rishab, about the state of Texas with SB4, the abortion ban, with the governor's directive for DHS to now investigate gender affirming care for parents that of their children who are receiving this care. When they know us, they cannot deny us. So going back to the opportunity of sharing who you are, how you are, what your belief system is, we're not allowed to make it harder for other people to live their lives. So when we have the conversation and reinforce that in our community circle, on our block of where we live, if we know our neighbors and they know us, we are not stigmatizing. We are not that person that they may have had an impression on 20 years ago. That's the opportunity for us to be able to say silence equals permission. When someone is speaking in a way that I don't agree with, my silence gives them permission to continue to behave in a manner that is derogatory and detrimental to my well-being. The same thing goes the other way. When Lakeisha is saying something positive, I have to tell her, keep saying it. Otherwise, her voice will get quiet. So silence equals permission goes both ways. So be mindful of how we use it. Our voice will always be louder. This one will always be louder. Sometimes we have to change the message, but we'll get there. And that's the part, is don't give up. Only look back to see how far we've come.
Yes, come on, Greg, with the old HIV, your silence will not save you. Come on, pull the movement forward. We have to build on those historic analysis and bring them forward with us. Ashe, yes, Greg. Your silence will not save you. And we have to keep understanding that in new ways. We have to make sure that we make room for our trans babies, right? We have to protect them at all costs. We have to protect the mere thought that, right, the Commerce Act, like conservatives are now challenging that Commerce Act, which is like, I, as a human being, can't cross state lines to go to another state to seek healthcare if my own state is denying me my humanity, is something reminiscent of slavery, right? Like the mere thought of not being able to move across state lines and be free in your body. Like, who gets to own who gets to own that experience for you? For you to get an abortion, I don't get to say that. And so we have to be mindful that when these laws are coming up, that we are educating ourselves in our communities on the realness and the impact of them, and educate ourselves and talk to ACLU and reach out to human rights organizations that can come and speak in our community. We have them. We need to use those resources now more than ever. And people are in need, and we need to assess that need and get community resources to them as soon as possible. We're having more environmental impacts that are also impacting our bottom line and our ability to access medical care and services. So all of these things are coming into play, and we must not get overwhelmed to the point that we are doing our own self a disservice and therefore ourselves. So evaluate the resources you have in community, utilize those, and pace yourselves and protect our babies, our trans children at all costs. Those are my final words.
Wow, what a great way to, what a wonderful final word. And I'm not going to say anything after that, because that is exactly where we want to land. So thank you to both of our speakers today, Lakeisha Harris and Greg Casillas. We are so grateful for you, and all of NASDAD and all of the 52 folks here on the call are so happy to have heard your stories, your best practices, your wisdom, and your sage advice. And so I want to pivot us to our conclusion today. And so with that, I'm going to turn it over to Ilana to talk through some of these resources that we've listed on the screen here. I just want to make a note that everything you're seeing here, as well as all of the resources that Greg and Lakeisha shared, will be emailed to all of you in a follow-up communication following the webinar, as well as all of the contact information for both Lakeisha and Greg, should any of you want to get in touch with each of them. So with that, I'll turn it over to Ilana to talk through these resources, then we'll close up shop.
Awesome. Thank you, Drew. So yeah, we have a lot of stigma reduction resources that we want to share with all of you. I'm not going to speak individually about each one of these, but on this list, we have the resources from End Stigma and HIV Alliance. We have the Sex Work Decriminalization Toolkit from Lakeisha, and then we have various NASDAD and other organizational resources. We want to be able to provide you something really concrete after this webinar. This conversation has been a fantastic resource, and we want you to keep being able to propel that forward with some of the things that Lakeisha and Greg spoke about. And we really appreciate you being here. If I could go to the next slide, that would be great. Here you have our information. And for Greg Casillas, Lakeisha Harris, myself and Vrusha. And I really want to thank you all for coming today. We really appreciate it.
Thank you so much, everyone. Thank you, Greg. Thank you, Lakeisha. And one last thing, we'll have the recording available as well. So once, for those of you who couldn't make it, or your colleagues who couldn't make it, we'll make sure you're able to access this rich discussion at some point in the future as well. Thanks, everyone. Have a lovely morning, afternoon, evening, wherever you may be. And we hope to see you on future NASDAD webinars in the months and weeks to come. Take care.